offer a program for post-op total knee range of motion as well as reconditioning, especially of the quadricep. The recent research has shown that the earlier you facilitate the quadricep, the better outcome the total knee patient is going to have. Now, there's 4 exercises here, and some of them are taking your traditional exercises but adding just a little bit of a twist to it, and I'd like to go over those. So the first one, and Barry here, he's 12 weeks post now, but we saw him coming right out of the gate. He had bilateral knee replacements, and so he's been very well versed with these exercises. And the first one we do a little reciprocal movement. And what we do is we'll have the patient extend one side, but bend the other side, and then come back and flex. So if you think about post-op day 1, 2, 5, 7, in those first 21 days, start getting your patients to do a reciprocal motion. What this does, and you see when your knee is freshly replaced, the amount of effusion, and what this exercise does is it'll help facilitate the quad to get that muscle pumping action. The second exercise is fairly similar to that in terms of trying to get the pumping of the quadricep, and it's done with a contract-relax method. First thing you do is the patient dorsiflexes the foot, and they bring the leg all the way up to full extension. Sets the quad, then back down. The next one, he goes up, but Barry's not going to flex his foot. He's just going to let it relax. So he's going to let it back down. Third rep, he dorsiflexes, he brings it back up. So every other repetition, he's dorsiflexing the foot. If you try this at home, you get a tremendous increase in quadricep contraction when the foot is dorsiflexed, and it relaxes the hamstrings. The hamstrings causes the lack of the knee extension because of the spasm. So 2 things cause reduction in the range of motion that we can help the patient with, is to reduce the spasm in the posterior part of the leg, as well as getting rid of the effusion by muscle pumping. Okay. Third exercise is that as Barry extends his leg out, he's got to dorsiflex, and then he's got to bend this side back. Now he's had bilateral, which is not the most common way people have their total knee. So they usually have another side where they can flex real hard and really extend. So the harder he extends, the harder he bends. He gets a much more maximal contraction here. Come back down. The fourth exercise is for range of motion for knee flexion. This is a common position we put the patient's leg. I'm going to do a little traction, then I'm going to slightly internal, and then I'm going to bend Barry's leg gently. When I get to that point he doesn't like, he straightens that other leg out. And the stronger he straightens this leg out, the more relaxed this side gets. It's actually more comfortable, and the best thing for the patient, you don't have to push as hard if you extend this side while you're bending this. After you've done those, then you have the patient stand up. Now you're going to start, normally you take them for a walk, right? If rehab unit, in an inpatient situation, or even now we're seeing patients 2 days post. But now we're going to put him into what's called the retro step, and I go over this extensively in the course. So he's got a toe touch in the back, and so if he had a standard walker, right, he'd be holding on to his walker. And then what Barry's going to do, he's just going to rock back, and then he's going to dorsiflex his foot, and then come back. So he's going to go back and forth. He's going to go about 15 repetitions. As he does this, as his heel goes down, and he dorsiflexes that side, the dorsiflexion over here causes the quadricep to contract over here. So this is an eccentric contraction. It works on the stance phase of gait. If you can improve the patient's stance phase, you're going to improve their stride length, which increases their stability, their cadence, and their achievement of a more normal gait in the first 21 days. Try those exercises and you'll see that you'll be much more effective than the usual care of treating a total knee patient.